I'm going to talk about Medicare Advantage HMO plans. And certainly important to understand, when you come into Medicare, you have a lot of choices. So some people get confused on Medicare Advantage, Original Medicare, HMO, PPO. So we got to make sure we figure this out. I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country in all 50 states make the right Medicare choices. And I can absolutely help you as well. One of the best parts is there's no cost to you to utilize me to help you. So I certainly hope you'll take advantage of everything that we have to offer, and we'll make sure we get all your pieces in the right places. So right now we're going to talk about Medicare Advantage HMO plans. And again, this is one of your big choices when you come in. Now there's always questions, so if you have any questions after the video, feel free to give me a call, send me an email. I'm happy to help with any part of Medicare. So just reach out and I'll do my best to make sure we get you the right answers. So when we talk about HMO plans, what are HMO plans? They are what is called health maintenance organizations. You're probably familiar with this if you've been in the workforce, and if you've worked for a large company, you may have been on an HMO for quite a while. So you may be familiar with the process, but it's certainly important to understand because again, this is going to be your major choice when you come in to Medicare. Do you go into Medicare Advantage or do you stay on Medicare Original and have a Medicare supplement plan? Now with Medicare Advantage HMO plans, they're offered by private insurance carriers, and they have a network of hospitals and a network of doctors. So just like what you may have had at work, you have to go to these specific doctors and hospitals, or it can be significantly more expensive to use, really prohibitively more expensive to use if you go out of network. So make sure you understand with an HMO plan, you absolutely have a network. And generally, you're going to choose a primary care physician. So that can be your family doctor. But where people have had problems in the past is when they have to go to a primary care physician before they can go to a specialist. So you may need to get a referral from a primary before you go to a specialist. And that is really the number one dissatisfaction on an HMO plan, is the fact that you have to jump through hoops before you go to a specialist. So HMO plans may include some additional benefits like drug coverage, dental, vision, hearing, sometimes some other things like even chiropractic and things like that. But make sure if they are promoting additional benefits that you look closely at them, because a lot of times they're very basic. So especially on dental, it's not like having a full dental plan. Generally, it's more of a preventative discount type dental plan. So just make sure you look closely at what they have to offer. Now, HMO plans for cost obviously are going to generally be less expensive on premium. So they generally have a lower premium. So Advantage plans are more of a pay-as-you-go type scenario. So it costs you more, or it costs you less up front, but then it can cost you more when you are going to use it. So generally speaking, for 2021, the out-of-pocket maximum on a Medicare HMO plan is $75.50. So that's a pretty big maximum out of pocket. If you compare that to something like Original Medicare with a Medicare supplement, your out of pocket max is going to be in the hundreds of dollars generally, versus this in the $7,500 range. So also important to understand, and again, I can walk through this with you to make sure that we understand our choices, and then that way whichever one you make is the right one, but we want to make sure that we understand. So HMO plans cost, you have in-network and out-of-network. Again, if you go in-network, much more affordable to use. If you go out-of-network, then it's almost, again, prohibitive. There's really basic benefits for out-of-network type usage. So important to understand that too. So when something catastrophic comes along and you want to make a choice, you want to make sure that you have that choice to make. So you would generally have lower premium, but it is generally more restrictive to use. So again, those are the things to understand when you're making this choice, because this is again, this could be a lifetime choice going forward. So we want to make sure we get it right. So feel free to give me a call, send me an email. I'll walk through different parts of it for you. I'll tell you exactly what I would do. And then again, at the end, as long as we understand our decision, whichever decision we make is the right one. So I hope you found this helpful. Please subscribe to my channel. You'll have access to all my videos going forward. You'll get updates when they come along. And I hope you found this helpful. Have a fantastic day.